Good morning. Myself Varun Kumar, faculty of SNS College of Physiotherapy. Today we will see about the therapeutic techniques. Let's discuss about today's class. So introduction. So therapeutic techniques are the specific physiotherapy methods and approaches used to restore the function, reduce disability and promote the independence. They are applied based on the patient needs, stage of recovery and overall rehabilitation goals. So therapeutic techniques are the specific physiotherapy methods. So it is one of the physiotherapy method which involves various approaches which are used to restore the patient function and also to reduce the patient disability and promoting the patient to be independent in their life. And for that they are applied based on the patient needs because patient will be differ from various conditions. So based on that conditions we have to decide the therapeutic techniques, or we have to decide that what will be the treatment needed for the patient. And also it depends on the stage of recovery. So at the time of a therapy, patient will be in various stages of recovery, and also patient depends on the overall rehabilitation goals. Okay. So principles of therapeutic techniques. So for in the principles of therapeutic techniques, it should be focused on the patient centered and the individualized. So it may be either patient centered or therapeutic techniques should be focused on the individualized, and it begins early and also progress gradually. So whatever the therapeutic techniques we are applying, it should be begin as soon as early, and also the progression of the therapeutic depends upon the patient progression. So main aim is to restore the movement, strength, coordination, balance, and then the endurance. It is the use of functional, purposeful activities whenever possible. So incorporate patient education and home programs. There should be a proper patient education and the proper home programs must to be followed. So monitor for contraindications and complications. So during the application of the therapy, we should be follow the or maintain the or monitor the any possibilities of contraindications towards the patient, and also we have to prevent the complications regarding to the patient. It depends upon our therapy. So techniques and applications. So initially there will be a joint mobilization. So in this joint mobilization, the purpose of this technique is to restore the joint range of motion by reducing the stiffness, and also we have to relieve the pain. Methods. So in joint mobilization there are the various methods like passive oscillatory movements, sustained stretches, Maitland or Carlton-Bone grades. Applications. So the joint mobilization can be applied after post fracture stiffness or any arthritis conditions or post immobilization. So next one, reducing the spasm. For that techniques we are using gentle stretching, positioning, relaxation, hydrotherapy or cryotherapy. So application, spasticity after the stroke or spinal cord injury or cerebral palsy. So assisting the weak muscles. So for that facilitation techniques used. So what are the techniques we can use in the facilitation techniques means tapping, quick stretch, and then the PNF patterns, and also use of biofeedback and electrical stimulation, and also applications post-stroke hemiparalysis or peripheral nerve injuries. Then increasing the endurance. So for that progressive aerobic training can be used in the walking, cycling, treadmill. Then interval training for cardiopulmonary patients. Then monitoring with the pulse, blood pressures and box scale of exertion. For muscle re-education after the muscle transfer surgery, aim is to train the transferred muscle to perform new function. For example, tendon transfer in radial nerve palsy, we can use the techniques like repeated practice, functional activities, and then the biofeedback. Next technique is the strengthening muscles. For that, we are using isometric exercise or isotonic exercise or isokinetic exercise. Then progressive resisted exercise can be used, and also for application post fracture, rehab, and also osteoarthritis, then muscle weakness. Then for improving the coordination, we can use the techniques like Frenkel's exercise, PNF pattern, then task specific training. For application, we can use the cerebellar disorder or multiple sclerosis condition, and also for improving the balance. So for static balance, we can use the standing on a stable surface or tandem standing. In dynamic balance, we can use the reaching, stepping or wobble board activities. For gait training, we can give the pre-gait activities like weight shifting, stepping in parallel bars, then gait training with aids like crutches or walkers or canes. So advanced training like ramps, stairs, uneven surfaces. So in physiotherapy precautions, so avoid overexertion in the cardiopulmonary patients, prevent the joint overstretching in unstable joints, respect the pain limits during the exercise, then monitor the vitals in high risk patients. So for in a case example, patient with a 45-year-old who is a female, post-stroke with left hemiplegia. For that, we have to give a recap plan like joint mobilization for stiffness shoulder, spasticity reduction with the positioning, muscle facilitation for weak dorsiflexors, gait training with cane, then balance training for safe mobility. So overall summary for this topic. So we have to know about the therapeutic techniques in that joint mobility, spasm reduction, strengthening, coordination, balance, endurance, and gait training. So we have to focus on these conditions or these techniques for relieving these problems. So thank you.